At least 22 states have reported spikes in new coronavirus cases this weekend. That includes Arizona, Florida, and Texas. And that has helped push the overall number of confirmed cases in the U.S. to over 2 million. In New York, there were multiple videos that went viral over the weekend showing large crowds in bars and restaurants, people violating these coronavirus restrictions. And New York Governor Andrew Cuomo threatened to revoke their liquor licenses if those establishments cannot get their crowds under control. And he said there is a, quote, very real possibility that reopening in certain areas could be rolled back if there is a spike in new cases. Meantime, Chinese authorities shut down parts of Beijing over the weekend after recording a record number of new infections there. Authorities are now facing a nearly impossible decision: allow economies to open and take the public health hit, or lock down countries and take the economic hit. Here to help us sort it out is Yahoo's medical contributor and Columbia University Associate Professor of Emergency Medicine, Dr. Dara Kass. Doctor, good to have you with us again this morning. I'm going to start by asking about contact tracing, because we keep hearing about how critical that is to reopen economies. Given that we're having this spike in new cases, is contact tracing enough, or do you think we're going to have to reimpose those stay-at-home orders in some places?
So, Alexis, these things aren't mutually exclusive, and contact tracing is not supposed to replace smart human engagement. One of the reasons why we say over the next few months that you should engage repetitively with the same group of people and know who you're connecting with is that these large group gatherings of people we don't know, people that are, kind of like coming from all over states, like we see with the rallies maybe that are going to be planned, or other concerts or other events like sporting events, they can bring people together that are hard to find after the fact. So contact tracing is really important for known contacts and known positives, but it won't be able to keep up with large gatherings of unknown persons if that's how people choose to engage.
What about vaccines? I mean, anything new on a vaccine coming to market by the end of the year? Because we keep hearing that that's really the way we're going to be able to fight COVID-19 in a meaningful way and reopen our economies and feel confident about it.
So I think that vaccines are very important, and we're very excited about all the advances that are coming. But even if we were to get a vaccine by the summer of 2021, it would still be at lightning speed compared to other vaccines. And we can't simply wait that long to have our economy move forward. So we need to do things that are smart. And one of the human experiments we lean on is the hair salon in Missouri, which had 2 infected hairstylists that were symptomatic, that exposed 140 people, none of whom got sick because everybody was wearing masks. And so one of the things that we talk about in public health, especially as it relates to the economy and picking which businesses should open first and how they should open, and more importantly, pulling back. The interesting part about what Governor Cuomo is saying is he's using economic leverage to make sure that people do the right thing from a public health perspective, which is in our global economic best interest. And so I think that that's how we need to see things. Use masks, wash your hands, respect space, and let's move forward, not back and forth, back and forth. That's not sustainable. We can't open and close schools. We can't get businesses started and then pull them back. What we need to do is do things that are smart and sustainable as we move forward.
Dr. Kass, for the average person out there, why does this virus come back so quickly? We've all been socially distancing, or most of us, for the past 3 months. We've been locked at home. Now we're venturing back outside. Why does it come back so quickly?
So I think that the best analogy I can use is a fire. Think about a fire like when you're lighting a campfire. Good summer analogy, right? When you decrease the amount of wood, the fire comes down, but it never really goes out. And as soon as you increase the amount of wood that can catch fire, the fire will come back up again. So it's not to say that the virus has gone away. It's that we've decreased the amount of burn that it can go through. And if we keep the virus at a low burn, keep socially distanced, and keep people apart enough not to stop businesses from moving forward, but to keep the fire from catching, then we can start to see a sustainable burn that also allows us to exist in a reasonable economy. So don't please think that this virus has gone anywhere. It hasn't. We've just kind of quieted it down so that we can move forward.
Dr. Kass, is there a feeling that if there are fewer hosts for the virus to sort of make its home, that it will lose its potency, and that by us social distancing and fewer people catching the virus, that in and of itself will make it a weaker virus?
It's not that the virus is weaker, it's that we're better at addressing it. Think about the idea of our resources. Part of the reason we stayed home in the first place was not to overwhelm our healthcare system. It wasn't to say that we had, a fixed number of treatments and we would stop treating people, but we really needed to keep our system going forward. And so it's not that the virus has weakened, it's that we've given it less to fight against. We're really able to address it earlier. That's where the testing comes in, the tracing and the isolating. It's that one person affects, maybe nobody else, right, instead of two other people. And that's really why it feels less potent, because it's much less dramatic and the tidal wave has really calmed down.
Doctor, could you give us some optimistic data points you're seeing in the data right now? So many folks, at least from a Wall Street or an investor standpoint, have been spooked because of rising cases the past week in 4 or 5 states.
I think the optimism is that we know what works. And if we do it, we should be able to move forward consistently. We can open businesses and offices in ways that are socially distant, but sustainable if we ask people to wear masks and expect it from them. This is where local leadership and business leadership is actually going to step up and even keep ahead of the numbers within their organizations and their communities to say, if we see 1 or 2 people that are feeling unwell, support people staying at home, we really can move forward, and we can do it now in a way that keeps our economy going and gets people back to work, even in some office spaces.
Doctor, I know it's still really, really early in terms of the way science looks at timelines, but is there any evidence that antibodies are working, that people who got the virus once may not get it again, or if they do, it won't be as bad?
So I would say that our timeline is moving faster every day, and we haven't seen any reinfections, as far as I know, of people that have documented antibodies being exposed consistently, myself included, right? I've been going back to work in the ER. I have antibodies wearing the same PPE, but I haven't gotten again, even though I got it the first time. So what I would say is that we are optimistic that the antibodies are protective. We haven't fully been able to prove it yet, but I will say that that will allow us to know at least who has a first layer of protection. It's not going to be the immunity passport like we've talked about in the past for lots of other reasons, but it will give people a sense of calm around the idea that if they have had it and if they mount some level of immunity that we track, that they'll be protected again in the first iteration of this virus, at least for some period of time.
The spikes that we've seen over the past 2 weeks, Doctor, is that the new normal? Is that what people should expect this summer?
So I think it's the new normal if this is how we continue to act. One of the things we talked about was that the states that opened early opened against the guidance of the White House. They didn't have the decreasing number of cases. They didn't have the tracking and tracing in place. And so if this is how people want to live their lives, and this is an American, standard, is that people can choose this path. But this is the path they're choosing, which is to say that if we are not waiting for the data and we're just opening up because we're tired of this virus, we're going to continue to see spikes and hospitalizations, hit up at a time when we're going to have to somehow react or just let more people get sick and die.
Dr. Dara Kass, Yahoo's medical contributor. Thanks for that information. Good sound advice. Be well. Talk to you soon.
Thanks a lot. Have a good day.